My vision and hope after all that we are going through is that human beings, all of us, women and men, are going to be caring people, caring for one another. It's going to be a society that I hope will value everybody else's life, because it has shown us that life is something that every person, men and women, value. And that opportunities for survival, opportunities for food, opportunities for education, opportunities for people to serve their communities will now include women, because women have also been the center of this COVID-19.
In the aftermath of COVID-19, universities such as South Africa must prioritize efforts to overcome gender-based violence in South Africa and in the world. And to do so, we will need not only to participate in research and engage scholarship, but to ensure that work in these areas is translated to practical efforts at empowering women to claiming the future for themselves.
My vision for women in a post-COVID world is the co-creation and the giving birth to a new value-based ecosystem of cooperation where nobody is left behind. We can achieve this through the 3 steps. First, full knowledge of the self, bringing our vulnerability and our full selves into everything we touch, including our own agency and our own truth. Secondly, cultivating quality relationships through communication that exercises active listening, generative listening, that empowers not only the person that is hearing, but the other. And thirdly, by knowing technically the systems that are underpinning our current society, so we can modify them and revolutionize them in a gentle but revolutionary way. I think the first step to achieve this is to know ourselves and to change ourselves, because through the change of the self, we can change the world.
Good afternoon and welcome to International Women's Day 2021, actually the eve of International Women's Day. As the Thabo Mbeki Foundation, we really appreciate everyone who's joining us today as we kick off what promises to be an exciting discussion where we intend looking at the gendered responses to the COVID-19 pandemic. We're also going to raise questions with our panelists, and our keynote speaker will deal with this as well, on how gendered perspectives can contribute to urgent action for equitable, inclusive societies. How can we equitably support girls and women under COVID-19? What about the pandemic? What can we learn from the COVID-19 pandemic and on how to act during crises? This afternoon, you are being hosted by the Foundation in partnership with the University of South Africa. And this is our 12th annual International Women's Day. This event will end at 4 o'clock, and owing to the strictures occasioned by measures to curb the COVID-19 pandemic, we regrettably, unlike last year, are having this online. But look, at the end of the day, we should also look at the opportunity it presents as we look to the reach. So our theme this year is a gendered perspective on a COVID-19 world. As you're all well aware, the UN Women's theme is women in leadership achieving an equal future in a COVID-19 world. So the theme of a gendered perspective of a COVID-19 world also forms part of a broader mandate of the recently launched Thabo Mbeki African School of Public and International Affairs, as well as the soon-to-be-built Thabo Mbeki Presidential Library, because women will be part of it and she will be telling and writing her story. At this particular point, I would like to introduce our keynote speaker, and our keynote speaker is none other than Professor Puleng Lenka-Bula. We'd like to use this opportunity to congratulate her on her appointment. She is the first woman principal and rector in the 148 years of the history of the University of South Africa. We believe that her coming in signals what will become normal in future, that it will just be acceptable that a woman takes up that role. She worked in various positions at universities, in communities and elsewhere. But I'd like to make a reference to the fact that Professor Puleng Lenka-Bula is a trained feminist ethicist with a PhD in social ethics. A doctoral study was on the bioprospecting and intellectual property rights on African plant commons and knowledge, a new form of colonization viewed from an ethical perspective. She gained a master's degree with specialization in social ethics from St. Andrew's College at the University of Saskatchewan, Saskatoon, Canada in 1997. She's participated as a board member of local and international academic formations, including the Council for the Development of Social Sciences Research in Africa and Focus on Youth. She's also been consulted for local and international institutions, including being a panel member on poverty, wealth, and ecology of the World Council of Churches. And Professor Lenka-Bula has already published in the nexus between ethics, ecology, feminism, and climate change through the Accra Confession prior to the Sustainable Development Summit. There's a lot more to say about her, but before she delivers our keynote address at this International Women's Day 2021, I would like to call on Chico Gondwe to present a poem to us.
It hasn't always been this way, you know. Daughters in the boardroom, heading institutions, running world nations, trade organizations. Nah, they never sat at the tables they set. Always they served, but were never served. Danced to entertain lustful noblemen who would marry them for political and economic gain. Called them concubines, never led them to uprise. All except one true gentleman. who prepared a place for his daughters to reign. Without intimidation or discrimination, but with wisdom and compassion, he placed the scepter of power in their hands and summoned them to rise and fight. I am such a one. I am the king's daughter. I declare that I am. I command every storm with the power in my tongue. I break every barrier with the love in my hands. When enemies strive, conquer, and divide, I bring us back together, overcome, arise, unmoved, fearless, unbothered, and calm. I am the king's daughter. I declare that I am. When masquerades in a dance encircle my life, for evils to pass, the armies of heaven, they come to my side to defend me and mine. No weapon can stand when the king lifts me up and places me high, locates me as the one of a kind, to run this mile and lend a hand. He positions me for greatness, to lead many nations and raise generations that will call me prophetic, because I am the king's daughter. I declare that I am. A boundary eraser, protocol breaker, territory ruler, dominion conqueror, favored and nurtured, mentored and delivered, from captivity to freedom, from hard times to good times. This time is my time to fulfill the divine plan and defend my land, because I am the king's daughter. I declare that I am. Standing in fields of great possibility, harvesting sheaves of new realities, revelations of restoration, dreams and recollections, legacies of celebration, decisions and repercussions. My heart chants aloud in poetic motions, recalling that I am the chosen one, born for such a time as this one, predestined to shine as the stars in the sky. I am the king's daughter. I declare that I am. A jewel in his crown, an arrow in his hand, a branch in his vine, my destiny stands. My journey is not common, and neither is my calling. I live for my choices and fight for my rights. I am love. I am life. I am the king's daughter. I declare that I am. Not enslaved to the bondage of poverty, inadequacy, or dysfunction. No, this is not my portion. But healing through wisdom, prosperity through wholeness. On this journey through life, this is my sole purpose. This world can never give me what it promises to keep me. A century, 48 years took a long time to hear me. To recognize my essence, acknowledge my presence. To know none can quench the fire burning within me. The power of the eagle propels me to fly. These wings will never fail. This vision will never pale. Through trials and tribulations, still I will reign, because I am the king's daughter. I declare that I am. I am the king's daughter. I declare that I am.
I would now like to hand over to our keynote speaker, Professor. It's your turn.
Thank you very much, Program Director, Minister, former Minister, and Dr. Moleketi. I am privileged and appreciative of the invitation to be the keynote speaker for this august event, wherein we are celebrating the International Women's Day. In particular, we recognize that this occasion marks a moment where we should lift up ideas, ontologies, aspirations, and dreams and practices around the imperative for a just world where women and men relate to one another with dignity. The patron of Thabo Mbeki Foundation and the Chancellor of the University of South Africa, President Thabo Mbeki, the patron of the Women Development Business, Mrs. Zanele Mbeki, the chairperson of the Thabo Mbeki Board, Dr. Brigalia Bam, acting dean of Thabo Mbeki African School of Public and International Affairs, Professor Vil Nkomo, and leaders of academic institutions here present, honorable ambassadors, members of the diplomatic corps, and international organizations present, members of the business community and civil society present. Good afternoon. In a poem about COVID-19 titled Positively Outraged with COVID, an open letter to coronavirus, Kenneth Ngwa writes, and so we connect the physical waves to another form of waves, the epistemological wave. We may or may we not swim again in the oceans, but we can produce artistic and ritual activities that stimulate our experiences of erasure and alienation and transition out into openings for new beginnings we may yet to stand between the wilderness and the water to ensure that the weary pilgrims are refreshed, sinking bodies rise from deep seas. This is the work of trauma hope, the weaving of the fragments of histories and histories into the new future. Although the poet is outraged by the huge devastation that is caused by COVID-19 pandemic, as it alienates people from their daily routines, its devastating impacts on the world economies, its impacts on women, particularly its rising tirade on gender-based violence, he bemoans that we may, as we deal with the present that is a challenge, think around the possibilities of the future, the weaving of the fragments of histories and histories into the new future. From the title and topic that I've been asked to present on, I thought it was important for me to locate the implications of COVID-19 for South Africa, for gender, but also for the aspirations of the future that we dream for it is important that even in contradictory contexts, that we imagine and point an optimistic direction into the future, which, however, does not hollow out the imperative for analysis. We are reminded that as we imagine hope, that it cannot be realized without inclusive futures where we foreground holistic gender equality and against gender-based violence, which in South Africa we have named as the second pandemic. Its red, its ugliness within these contending challenges of COVID-19. It is indisputable fact that both locally and globally, the victims who are hardest hit by the huge devastation and trauma caused by COVID-19 are in the main women, especially African women, including those located within South Africa. It is also important for us as we think about the present and the future to acknowledge that the geopolitical, historical, and economic contexts have generally been characterized by the feminization of poverty in South Africa and in the global world, where women or the faces of poverty are those of women. Continued in this trajectory are the bifurcations of society where gender as an important feminist lens and analytic frame by women, womanists, and other feminist activists quite importantly tells us that in spite of also the challenges that are structured that we experience, that the formal and informal sector are the informal employment or underemployment arena. This implies that their jobs in the main have tended to be insecure and relegated to the informal sectors, thus their lives perpetuating the persistent struggles to being human yet again. There is thus a general perception among scholars that the gains and feminist activists, that the gains that gender equality had been ascertained have now been reversed. The pre-existing inequalities are deepened, exposing vulnerabilities in the social, political, and economic systems, which are in turn amplifying the impacts of the pandemic. Antonio Guterres, for instance, argues that we could reverse the limited progress that has been made on gender equality and women's rights. It is therefore important for us to consider, as we think about the future and the hopes of women in post-COVID-19, that we must first begin by considering the implications of COVID-19, the pandemic crisis that has been for them, and what COVID has reminded us or taught us about gender inequalities, especially in relation to women, but also in relation to the economy. In considering the status of women in our society, we must reflect on the intersecting and multiple roles that many women play in our societies as mothers, workers, spouses, partners, breadwinners, students, leaders, and inventors within the knowledge arena. We must also consider the precarities within which many of these roles are performed. These include the conditions of work that foster cultures of harassment, discrimination, gender insensitivity, the threat of gender and sexual violence, both within the public and the private spheres. The pay gaps between women and men in the world of employment, amongst others, and research shows that COVID-19 pandemic has affected women more than men, both as frontline workers and at home. Our own system and an executive of the United Nations Women has also stated that COVID pandemic has exposed the deficiencies of public and private arrangements in society that currently function only if women play multiple and underpaid roles. In this sense, she argues that we need to consider COVID-19 as more than just a public health issue, but an important arena for our analytics. And this concisely is entwined with feminist scholarship, particularly Crenshaw, Kohler, and others who have asserted that the intersectional understanding of life must at all times be at the center of any imagination around creating constructive futures that engender the dignity of women, of also that takes into cognizance the gendered and non-conforming gendered lenses of analytics of the socio-ecological and economic environments. If we look at the trends regarding women and the job market, it is not only unique to South Africa, but also in the global arena that women earn less, thus save less, if at all, any savings. They hold less secure jobs and are more likely to be employed in the informal sector. One example that can be cited as the case in point is stated by Statistics South Africa, where it records that in the unemployment rate of 37.2% in their labor insight of 2020, a percentage which was densely populated was women. The income gap between the genders persisted. Women formed vast majority of workers in the industries in tourism, fashion, retail, hospitality, health, home care, foundation phase, education, beauty, entertainment industry. And majority of those are the ones who have been let off when COVID lockdowns or challenges were put in place. It is also irrefutable fact that jobs highlighted above are generally low-paying jobs when compared to jobs in the generally considered male-dominated sectors such as finance, management, agriculture, construction, mining, industry, technology, and science-related disciplines. With the sudden striking by COVID-19, changes had to happen. The threat of lasting negative implications outweigh the positive losses for women that continue to becoming structural. Job losses for women pose a threat to women empowerment and progress in industry, moving women equality backwards after immense progress has been made. Such job losses entail the loss of retirement funds, pensions, but also retracking back women to cycles of poverty, especially those from single-headed family lives. Cycles of poverty get perpetuated as education of girls in particular, or non-conforming queer individuals tend to be tampered with. Economic uncertainties often mostly lead to sexual exploitation and abuse of women and girls in search of food, essential supplies, but also in the structural and organized systems. Some of the highlights of COVID-19 has been that inequalities in educational opportunities linked to universities, a sector which we are from, have demonstrated such a major challenge in this area, including the digital access and success in performance. The practice of care, which in normative unequal relations has always been a burden of women, doubly became an important, if not an essential, contesting and constricting arena for women. The exposure of women in violence during this time has been demonstrated in many a times newspapers giving us information around the lives lost or the lives that have been decimated due to violence. Women's mental health linked to depression has also seen a rise in the COVID context. And therefore, for us to imagine the futures, we must ask the questions. What type of futures do we think will be imperative, and why should it be imperative or prioritized? How do we ensure that as we think around the achievement of gender equality in celebration or commemoration of the gains made in the International Women's Day and associated or attended efforts at overcoming and radically changing and transforming gender-based violence? How do we ensure that we tackle gender gaps in the world of work, but also in family relationships? How do we ensure that we recognize unpaid work and care work that many times women tend to be inserted in and therefore do not often get the requisite financial remuneration? How do we ensure that the programs that are aimed to bridge the gap or overcome the inequalities and bifurcations instituted by gender inequalities are overcome? It is my contention that we should not only prioritize women's economic empowerment, the therapeutic interventions that women have always called on to adapt, to be resilient, to support others and to comfort others, or even the spaces and means to heal in the post-COVID-19, but we must also ensure that we rethink the locus and analytics that help us to rethink forms of labor, of family life, of spaces of work, of modes of working that prioritize gender equality. If companies have proven that they can be productive, tapping into the fourth industrial revolution or the 4.20 industrialization, some women can be given flexi in and out of office schedule to accommodate their needs in order to ensure that their productivity at home and at work are ascertained. It is also important that for those who may have gone through losses of income for whatever reasons, whether it is separation with family or losing or replacing training or a sense of blended and multi-sited work environments, that we do this. However, could this be the only interventions that we imagine as important levers for engendering gender justice? I'm of the view that this may be micro and macro micro and meso interventions that have to be put in place. However, we must get into the structural policy systems that are entwined with the global arena in order that the interventions that we put in place are systematic, systemic, and seek to transform and change the world as we found it. This is particularly important because the socio-economic conditions within which gendered relationships manifest are often undergirded by violence, including the lack of opportunities for women to determine the futures they want for themselves. The second is because the solution systems that have been put in place to help obviate the health challenges but economic challenges that women and their communities or families go through during the lockdown have tended to a large extent position issues of individuals versus the collective socio-economic environments, which I assert are quite important, lest the policy interventions themselves continue to perpetuate the very bifurcations and inequalities that women, but also gender injustice has occasioned within our society. This will also ensure that the threats of the lasting negative implications of working from home, which have sometimes ensured that women have multiple responsibilities, are overcome. The lockdown level restrictions themselves have demonstrated, especially level 5 and 4, have demonstrated that whilst the opportunities for working from home may be important for multitasking and ensuring that women are inserted within their lives, the lessons have been very clear around sexual exploitation, abuse, economic exploitation, and others. How then do we envision a future in a context that sounds so gloom and in a context that requires multiplicities of analysis? I'm of the view that perhaps it is imperative for us in analyzing the implications of COVID and the policies decisions that have been made to ask the questions, have these been relevant for women, their communities, and for the future? It is also important to ask, is gender an adequate analytical framework if we assert and affirm that there are gender non-conforming queer individuals who would like to ensure that the world manifests justice in ways that justice allows all of us to flourish? It would seem to me that multiple sides of analytical frameworks are important in order to ensure that the dialogical relevance and benefit of gender-based analysis entwines with all efforts of human rights assertions for dignity, in order that those who are on the margins and the quest for gender justice is intersectional would be a cogent point to make. In particular, this global crisis that COVID-19 has spawned has demonstrated the internecine relationship with the politics of the global north and the global south, particularly on global trading systems where vaccines, distribution, and access have demonstrated competitive cultures instead of the car culture that feminist discourse have often centered as important imperatives for ensuring that life in abundance for humanity is manifest. For instance, the logics and cultures that have ensued in the discussions or even the solutions that have been brought forth on COVID-19 have been quite experientially collateral, in the sense that those who cannot, the uncertainty, for instance, the nominal epidemiological and medical expertise, or some expertise that have been attended to thinking around medical interventions, have to a large extent not even considered the existential knowledge, endogenous knowledge systems that scholars such as Odora Hoppers said are quite important to interface with the new or the natural sciences and interventions that epidemiology or vaccines have proffered. But also important is the fact that we in South Africa, but also other African countries, have sought to look for money from international financing institutions in order to obviate the challenges that COVID-19 has exposed for society, especially in the economic arena. The challenge, however, has been that we have capitulated to the machinations of the global economic systems and its sometimes unintended consequences that plunge citizens and women into indebtedness, where the ideological artilleries of death and where the rehashing of the ideological artilleries of death are occasioned and continue to manifest. What does this mean? When the new World Trade Organization CEO asserted that the vaccines must be distributed in order to ensure that they are accessible, the profiteers were not comfortable with this, and instead of acknowledging her talent, described her in an ageist manner that challenged her idea of an inclusive economic intervention that has global regard for these challenges, understanding the vaccination distribution as an important lever for us to taking into cognizance. But it is also important for us to then note that in spite of the fact that the promises were made, including by the International Monetary Fund, that the loans that would be given or granted would not exact into the micro financial systems of countries, we have realized that the political grammar of the custodians of fiscal policy and economics at a local and global levels have tended to suggest that there are no compromises on the sovereignty of countries in the loans that have been asked for in order to mitigate the challenges that COVID-19 has exacted on society. The truth and the lessons that we have garnered are that the elites of our countries, and not the women, not the marginalized poor in our countries, are the ones who have suffered the wrath of these investments, which should have actually obviated the life-denying milieu of apartheid-like or colonial-like arrangements which never took into consideration and which dehumanized the dignity of humanity and negated their living. And I want to take, for instance, the poem that Kyurapetsi Khutsitsile shared with us in the Wounded Dreams, where he says, though the present remains a dangerous place to live, cynicism would be a reckless luxury, toxic lies pulled high and deodorized to sound like the most clear signage showing us the way forward from here. And he continues to say, though the present is a dangerous place to move, the place to live, possibly remains what moves us. We are all involved. Indifference would simply be evidence of the will to die or trying to straddle some fence that no one has ever seen. For me, the invitation by this poet and poem is that we must take cognizance of the feminist call for gender budgeting that responds to the questions of economic access, distribution that give dignity to the lives of women and men in society and prioritizes the imperative for enhancing and supporting women. For it is also in changing policy systems like this that we will assert and change the patriarchal, hierarchical economic infrastructures and architectures that strip out women of their dignity, but also of their moral agency to overcome the challenges that they face. It would mean to me that as we imagine the 2021 and beyond futures, that we should be willing to co-create in a gendered way Africa of futures that primarily draw on our philosophies and ensure that issues of dignity, whether in politics, economics, and social arrangements, are important, and that gender justice becomes an imperative. We do not only need to draw on our own experiences of struggles for asserting the dignity of all humanity as important imperatives, but we must try to ensure that our own knowledge systems, technologies, and arrangements that enable us to put in terms the systems that involve women and men in the rethinking and reimagination of the future becomes an important arena. Scholars refer to thought systems such as those as the decolonization of thinking from the logics of conquest, of profit, motive only, but of distribution systems that allow people at all times to engage in the progressive and constructive determination of how they live and construct their futures. And therefore, we must be countercultural to mimicking the oppressive, economically unjust systems that COVID has sometimes exposed in terms of the global trade agreements, arrangements, but also the family and work relationships. We must ensure that the unjust systems are collapsed in the ways that feminist scholars such as McFadden, Odora Hopers, Pumla Kola raise, precisely because we cannot squabble around whether dignity is important for women, but we can squabble around how we ensure that is manifest at micro, meso, and structural levels. In particular, I want to reassert, drawing from Pumla's work on rape, where she gives a cogent argument that when we snuffle out life out of women and their communities, or those on the margins, through cultural systems of rape, we are definitely creating fatal conditions that deny the dignity of women to flourish, but also that deny communities where women are integral to their thinking, are central. We must rethink, we must reimagine and construct economic systems of futures that take into consideration these ideals of human rights, of economic justice, of gender justice, of awareness of gender non-conforming individuals and their assertion for the quest for dignity in our world. As an African intellectual and feminist scholar, it is my commitment as well to stating that the future that we should imagine must not only be limited to medicalized interventions that are separate from the quest for dignity as we shape and allow ourselves to participating in shaping the future. In particular, this requires that we invest in educational systems that will extricate women from cycles of continued poverty, but also their communities. It would mean that policies that deal with higher education, with basic education, with agriculture, and other related systems must take into cognizance the imperative to move into a future, for we are not interested or committed to building a future that continues to push us in the margins, but a future where we dialogically and intricately in the theorization or the praxis of such futures participate meaningfully and fully. I think if we don't take advantage of the spirit of advocacy that is already at hand around gender budgeting systems, we will actually lose out on constructive futures. For the non-attention in the fiscal and financial or monetary planning of our systems, which do not take into cognizance these ideas that women tend to bear and be the faces of poverty in our society, will actually mean nothing. To get to my conclusion, I'd like to reassert that if the responses to the COVID-19 are to be effective and not just another talk, we should ensure that we do not reproduce or perpetuate the gender inequities that we are accustomed to. We must create effective systems that do not only attend to the gender norms, roles, relationships, or agency of women and men, but we should take these lived experiences as guidelines for ensuring that we change, not transform our society for the better. The future requires a formulation of socio-economic plans that have an intentional focus on the lives and future of women and men, not only taking the economic systems into consideration, but also taking into consideration the economic, ecological, climatic changes that are constantly becoming threats for the future, which are extended by the COVID-19 and its intended or non-intended consequences. In this regard, we must ensure that the socio-economic plans are entwined with the ecological plans to ensuring that sustainability becomes central to thinking futures. For as we imagine a future where the economy, ecology, and justice are intersected, we will therefore create systems which are not only fit for the reality of workers or for women, but will be fit for the realities of all humanity and citizens and the next generations, which must benefit from the decisions that we take at the present. We must also ensure that the resilience of our grandmothers or forebears, which navigated patriarchy as African royalties who marched to the union buildings and thus made a gendered bodily resistance to the systems of past laws, who juggled the roles of being both fathers and mothers on account of a cruel migrant labor system, who were able to hold their own in the world of men, will teach us and has taught us, or will continue to teach us as women folk, as gendered beings, to have a sense of agency that allows our voices never to being muted, even when our wellness and well-being are challenged by COVID-19. The recovery for COVID-19 in the aftermath of this pandemic must therefore ensure, as Phumzile Mlambo-Ngcuka rightly asserted, that we must not rebuild the old world, but make women and girls central to the plans that bring a better future. The point here is that we should not strive to return to what we did, the so-called normal, but we must embrace COVID-19 pandemic as an opportunity to reimagine a different future. We must, in a profound words of our forebears, ensure that we change the situation, even the context of structural challenges, not relenting to the current dangerous place. For as we rightly asserted, we cannot be cynical or recklessly indifferent to the challenges that COVID-19 imposes for us as humanity, but also particularly for us as women, but also those who are on the margins of the economy, ecology, and justice. For the present must influence the future, and we must ensure that as we move into the future, that we take cognizance that gender is not just about the distinct biological differences, but it is the invitation to ensuring that dignity is manifest for all humanity and all citizens. Thank you.
Thank you very much, Professor Lenka-Bula, for that insightful intervention and keynote this afternoon. I will immediately go on to our panelists. And the first panelist to speak this afternoon is Dr. Jomo Kwame Sundaram, who has been the Assistant Secretary General for Economic Development in the United Nations Department of Economic and Social Affairs in 2005. There's a lot for me to say about Dr. Sundaram, but I'm not going to go into that now. We don't have the time for that. I will immediately ask you, Jomo, to go into your intervention that will look at the gendered perspective on relief, recovery, reform. So over to you. Thank you.
Thank you very much for your kind invitation to join you on this auspicious occasion, and also to discuss a very challenging subject. I want to particularly thank the Mbeki Foundation for organizing this event and also for inviting me. And I also want to congratulate Professor Bula on her recent appointment at UNISA. Allow me, especially since we are constrained for time, to try to make a few points. It's very difficult because Professor Bula has covered much of the landscape, including much of what I would have liked to say. But I think it's important for us in looking at the situation in which we live today to consider the opportunities as well as the pitfalls of the present moment. I think it's important for us to recognize that before COVID-19, that there had been a bit of progress. More girls are attending school. We also find that there are fewer women, for example, dying in childbirth, and fewer children, infants who are dying in childbirth. And we also find that there has been, at least in the last decade, over 130 countries in the world which have introduced legislation for gender equality. So all this has been progress. It is too slow, and it has been very, very uneven across the world. The new dispensation in South Africa basically opened up a lot of opportunities, and precisely because it was such an unequal society, there was perhaps greater appreciation in South Africa than in much of the rest of the world about the need to reduce inequalities, including gender inequalities. But what we see now with the pandemic, with COVID-19 impact, is that much of the very modest progress which has been achieved so far has actually been set back. And what we also find is that the pandemic has been worsening many of the other pre-existing inequalities which we find in the world, gender inequality being part of that, but also many other inequalities. And it's important for us to recognize that much of the gains of the recent period, for example, have also been set back, if not actually reversed. So we are living in a very, very challenging times. I know that's very common thing to say, but I think it is particularly important to recognize that women are especially in the forefront. In many of the frontline health workers, for example, are women. in most societies of the world, we find that a majority of frontline workers are women. So the inability, for instance, to get sufficient protective equipment for the frontline workers is an issue which has gender implications, undoubtedly. And perhaps we can even say that part of the reason why it is not being taken seriously, particularly by some in the rich countries, is precisely because of this. So we find, for example, that there have been quite a number of important setbacks, and that women are also especially burdened now because, as we all know, there is the disproportionate burden of care work, both commercial care work as well as unpaid care work in the household is borne by women and girls. So all this becomes a very, very major challenge to us. But also, it's precisely because we are living in these conditions that we have the opportunity to recognize this much more, and the ability, therefore, to begin to change. And this, I think, is part of the opportunity which we have today, and why we need to seize this opportunity. I think it is also important to recognize that South Africa, for various reasons, has had a very, very high burden in terms of the spread of the disease. And despite the various lockdowns and other measures which have been taken. And I think it's very important for us to recognize that lockdowns, stay in shelter lockdowns, are not the only way to try to contain the contagion. If we look, for example, at East Asian countries, East Asian countries have generally done quite well, and almost none of them actually have had stay in shelter lockdowns, except on a very, very localized basis. And this, for example, when the world was struggling to understand this new phenomenon of COVID-19, we find that in China, particularly in Wuhan city, where the pandemic first began and spread for at least a month until the end of January last year, that we see that there was a concerted response by the Chinese government. Stay in shelter lockdowns were temporarily imposed, not only in Wuhan city, but also in the 3 surrounding provinces, because many of the people who worked in Wuhan city, which has long been the industrial hub of China, actually commuted from the 3 surrounding provinces. So you had millions of people commuting every day to work in Wuhan city who were coming from the 3 surrounding provinces. Infections spread to the 3 surrounding provinces, of course, and hence it was necessary to have those stay in shelter lockdowns in those places. But except for that, and in the rest of China, you did not have stay in shelter lockdowns. In fact, in the rest of China, as well as the rest of East Asia, in Japan, in the Republic of Korea, South Korea, in the Taiwan province of China, even in poorer countries such as Vietnam, in Laos, or in southwest Indian state of Kerala, we find that stay in shelter lockdowns were avoided. And this meant for instance, that these economies, some of these economies have actually been growing continued to grow during the course of 2020. And this, of course, affects the welfare and the well-being of the workers and others who earn their living in these societies. So what we find is that stay in shelter lockdowns have actually been the result of not looking east, but rather looking west. Because it is in the West, both in the US and the UK, which are very, very influential for South Africa and for my own Malaysia, that we find that by looking west, we took a very nonchalant attitude initially. And by the time the pandemic was recognized as a major threat, it was too late, and it became necessary to take much more extreme measures. But this has meant that there has been much more disruption. There has been much more, many other problems as well. And part of the problem, of course, is that we do not have enough, we do not have a prioritization on the basis of need in the world, but rather on the basis of money. He who has the money is able to call the shots, able to get the equipment, able to get the medication, able to get the tests, able to get the protective equipment. And now to get the vaccine. So the result is that the burden on society has been far greater precisely because of the way in which governments and societies have responded. I want to emphasize that the job and income losses which have taken place were not a necessary consequence precisely for this reason, but rather it is very important for us to recognize that these were unfortunately imposed on us because of the responses which unfortunately governments took. I also want to emphasize that in those East Asian countries, as well as in Kerala, you had an all-of-government approach. In other words, it was not just left to the whole health authorities or home affairs to deal with these problems, but rather you had a very much more integrated approach. And so you began to realize that, for example, in Korea, they began to realize that it was not necessary for everybody to begin work at 8:30 in the morning. You could stagger work hours. You could begin work hours differently. You could have women having shorter work days, especially when the children need particular attention and so on and so forth. And so you had a great deal of experimentation, which much of this has been seen initially as responses to this crisis. But it's important for us to recognize, as Professor Bula emphasized earlier, that we now have the beginnings of a recognition that we can organize society very, very differently. Likewise, in households, it has become much more common for much of the household work to be shared, not only across genders, but even generationally. So all this have been very, very important lessons for all of us, which are very important for us to recognize. Now, when we look at the world of work, we all know that the world of work to differing degrees and in different ways has been is gender segmented. But it's also important for us to recognize that the pandemic has had very, very different consequences as far as the impact on work, on the world of work is concerned. Part of it, of course, depends on the nature of work in our societies, and our societies are, of course, very, very different types of societies and has been affected differently, but also public policy responses, not only at the national level, but also sometimes at the municipal level or the regional, sub-regional level. All these have been extremely important. One other important aspect which has been emphasized as well is the impact on what we call the care economy. And I think it's very important for us to recognize that there is paid care work, recognized paid care work, and there's a great deal of unpaid care work. And we need to recognize, we need to valorize the unpaid care work, especially because most of it is done by women and girls. And this is very important, that we should not only recognize and value work which is done outside of the household for money and so on and so forth. We should begin to appreciate a lot of the other kinds of work which go on in our society. Now, undoubtedly, in my mind, one of the consequences of this pandemic is that there's going to be far greater scope for care work, for commercialized care work in the future. And this is going to be very, very challenging. There's also going to be greater recognition of the crucial importance of public health. And because women are far more involved in working in public health, it becomes extremely important for us to recognize the kinds of opportunities, but also the risks which are involved in this matter. And another point I want to quickly mention is food supply. Food supply chains have been massively disrupted, partly as when they have involved international supply chains, but sometimes also domestically. Women's role in food production is very uneven. In some African societies, women contribute most of the work on farms these days because men have gone into the towns, into the cities to work. But I think it's very important to recognize that food production can be organized very, very differently. And we need to recognize that this should not be dictated to by the food companies, the agri-food businesses, which stand to make a lot of money from pushing their products, pushing agrochemicals and so on. So the crucial role of food preparation is also another important matter for us to recognize, because again, much of the burden of this in the household falls on women and girls. So in this regard, I think it is important for us to rethink what we traditionally call food security, but also to put greater emphasis on the question of food safety, because so much of our food today is affected by chemicals which are being produced for food, so ostensibly to promote food production. And many of the major initiatives internationally, as far as so-called food security is concerned, has been pushing many of this highly chemicalized food production. And in regards to this, I think it's very important to recognize that during the colonial period and in the post-colonial period, during the apartheid period and the post-apartheid period, to talk about traditional lifestyles and traditional diets is often not that meaningful, because they have been so fundamentally transformed. So much so that what our grandfathers ate is very different from what, for instance, was consumed over a century ago. So it's important for us to recognize that most of the diets, most of what we consider to be modern diets, are not very nutritious. And we need to pay far more attention to nutrition, particularly the micronutrient deficiencies, vitamins, minerals, and so on and so forth, as well as the risks many of us are running because of the kinds of foods which we take in excess, which is causes of so-called non-communicable diseases. I have no time to discuss some of the mental health issues which have come up, and I think it's important for us to recognize that much of the reported increase in violence against women during the pandemic period, not only in South Africa, not only in my own country, Malaysia, but apparently in most of the world, is partly due to the new stresses which have been introduced by the new kinds of conditions in which we live and work. So Professor Bula also hinted at the whole question of the financial system and how it constrains our responses. The financial system has become increasingly private over the decades, and it is now blocking both the funding of both relief and recovery measures. And it's very important for us as we go forward to begin to recognize that the financial system is actually dysfunctional in serving the developmental needs. So the last point I want to make, which is very important, I think, is that we have a situation where South Africa provided global leadership about more than a quarter of a century ago, when Madiba raised the whole question of the public health exception to TRIPS, the trade-related intellectual property rights. And now I think South Africans in particular should be proud that at the World Trade Organization, it is the South African delegation which has come up with a proposal to have a waiver for TRIPS, which will allow the vaccines, as well as the PPE, the personal protective equipment, as well as the medication and tests relating to COVID-19 to be waived, so that the developing countries can have much greater and much cheaper access. Because right now, production of vaccines, with the possible exception of Oxford AstraZeneca, have been constrained by the fact that many of these companies refuse to produce much more at much cheaper and more accessible prices for the rest of the world. So we in the developing countries are going to recover much more slowly, and this is going to worsen many of the problems which we've already, Professor Bula and I, have been talking about. So we face a lot of challenges. I think it's very important to recognize the gender dimensions of the challenges, and I do hope and I do appreciate this opportunity to contribute to this discussion. Thank you so much for having me today.
Thank you very much, Dr. Sundaram. I will immediately continue and introduce Zamanzima Mazibuko, who will now make an intervention. Gosh, I thought that I was. I simply want to say that she is a scientist. She is quite centrally involved in the knowledge economy as well, and is currently with the Mapungubwe Institute for Strategic Reflections. I will now give you the floor. Thank you.
Thank you. Thank you so much, Program Director. Good afternoon, all. There are many things that can be said about what a post-COVID-19 world should look like, but my contribution will look at just three. The first, research and inclusive evidence-based information being the main driver of decision and policy making, so more bottom-up and less top-down. There are certain decisions that policymakers take with an intention to assist the most vulnerable in society. However, because there was little to no research and consultation done in the process of decision-making, crucial and nuanced elements are not considered. Take, for example, the 350 COVID-19 grants implemented after around 3 million jobs were lost because of the strict lockdown regulations during the early stages of the pandemic in South Africa. While this was intended to support the vulnerable during this difficult period, the criteria for the grant excluded those already receiving other grants. This seems reasonable at the surface level, but dig a little deeper and you realize that poor women who lost their jobs, most likely informal jobs, because women are more likely to work in the informal sector, as previously mentioned. Those women were rendered ineligible to receive the COVID-19 grant because they were already receiving a child support grant, for instance. This intervention assumes that those who received the child support grant were not reliant directly on their employment or earnings to make a living. Essentially, it took for granted that those who receive grants are not impacted by job losses as they already receive a grant. The result of such a decision is that even though 2/3 of the 3 million that lost their jobs were women, 2/3 of the COVID-19 grants were paid to men. This means that because the majority of people who receive grants are women, this majority was not eligible to receive the social relief grant, thus disadvantaging women when they needed this assistance the most. In other words, poor women who lost their jobs were being disadvantaged because they have children. So in a post-COVID-19 world, we need policymakers to be more in touch with exactly what is happening on the ground, lest they disadvantage the very people they intend to assist. Policy decisions need to be more research-based and nuanced, and not merely a tick box exercise. Strengthened research capacity in policy-making spaces is a necessity. There needs to be an appreciation of how discrimination shapes the immediate needs as well as the long-term interests of women. Women need to be part of these decisions. Women need to be consulted in decision-making processes. In a post-COVID-19 world, taking into account women's concerns and experiences should be an integral part of the design, implementation, monitoring, and evaluation of policies and programs in all political, economic, and societal spheres, so that women benefit equally and inequality is not perpetuated. And this takes me to my second point on the syndemic's approach to disease management. One of the biggest lessons from COVID-19 is that diseases do not occur, spread, or endure in isolation. Context is crucial. Context matters. And therefore, context should be at the center of disease management. Generally, underlying structural drivers have rendered certain populations, especially African women, vulnerable to disease. These structural drivers influence both the spread and prevalence of disease, as well as the effectiveness or lack thereof of measures for prevention, reduction, or elimination. The syndemic's model of health puts emphasis on the biosocial complex, which consists of interacting, coexisting, or sequential diseases, and the environment and social factors, especially conditions of social inequality and injustice, that promote and exacerbate the negative effects of disease interaction. These factors tend to interact synergistically in various and consequential ways, having a substantial impact on the health of individuals and whole populations. When COVID-19 first hit South Africa, although it began in affluent areas, it was inevitable that it would reach the townships and spread uncontrollably because of the special planning. This is an example of social and environmental factors exacerbating disease. Furthermore, in the United States, it was reported that Black women and women of color were disproportionately bearing the burden of COVID-19. This is an example of political factors because there was COVID-19 denialism for a while, and it influenced the magnitude of the disease for a particular population. In recent years, the burden of diseases has been worsened by a significant increase in non-communicable diseases, or NCDs. There is thus an increased risk of the interplay of diseases, both communicable and non-communicable, and the impact of this interplay is aggravated by the social, economic, environmental, and political conditions in which a population finds itself. In South Africa, women have higher levels than men of the three comorbidities now strongly associated with those worst affected by COVID-19, namely diabetes, hypertension, and obesity. NCDs are closely linked with poverty. According to the WHO, women in less developed countries are extremely vulnerable to NCDs, which affect them in their so-called productive years. We have seen how women are more vulnerable to COVID-19 infections in South Africa. Stats show that women have the highest rates of infection across all age groups compared to the male counterparts. In Gauteng province, for example, 56% of positive COVID-19 cases are women, but only 50% of the population are women. This gap is largely occurring for women of working age and for the very elderly. One of the reasons is that women are in jobs that have higher contact care and frontline service work, which means they have increased exposure to the virus. Being socially disadvantaged means having less resources to protect oneself and one's family, and increased exposure to risk factors linked to disease. There is an overrepresentation of women in informal employment, and this environment is unlikely to support or enable adherence of COVID-19 regulations. Additionally, the vast majority of nurses and community healthcare workers in South Africa are women, Black women. They are the majority of frontline workers and have an increased risk of contracting COVID-19. Other reasons may range from women being more likely to live in crowded conditions, being more likely to rely on public transport, being more likely to report a poor health status and to live in households with pre-existing conditions. Women are also likely to have access to, are less likely to have access to medical aid and are more likely to rely on public health care services. Women are testing positive at a higher rate than men, and women have a greater social and economic vulnerability, particularly during the lockdowns. Is this something that has been factored into COVID-19 responses? A post-COVID-19 world needs to appreciate disease management differently. The importance of context and nuances needs to be prominent in the management of diseases, as well as for policies on social relief. The syndemic approach will assist in the development of inclusive public health policies and will improve the probabilities of effective interventions. There would be more targeted ways of responding to diseases and more focused interventions that take into account the multiple burdens faced by women. We would have a more exhaustive understanding of the foundational drivers of disease and equip societies and decision makers for their better prevention and control. And my third and last point, which is an overarching principle that the world should implement, and that is getting women into the mainstream of every facet of society and compensating them for the work they do. This means women's full and effective participation and decision-making in public life, and recognizing the incredible efforts by women and girls around the world in shaping a more equal future. The consistent devaluing of care across countries, including in relation to salaries and social status, has been highlighted by many feminist scholars. It has been argued that studies of the professions, in particular those concerning health workers, have sometimes reproduced the devaluation of women's work. There are calls for women's rights to decision-making in all areas of life, equal pay, equal sharing of unpaid care and domestic work. Many poor women subsidize healthcare systems by carrying the burden of care where health systems fail to plan and allocate proper resources. This puts the poorest and most vulnerable women in a triple jeopardy of excessive unpaid work, marginalization from the economy while staying home to provide care, and increasing household poverty from the cost of chronic disease. Community healthcare workers, which has already been mentioned that it's mostly made up of women, they need to be more formalized, provided with an environment that enables them to work effectively and compensated adequately. In the long term, it would be far more productive to be more proactive about mobilizing resources to build a strong health system than mobilizing in a panic response to a crisis, leaving women to carry this burden with little to no compensation. Ultimately, a post-COVID-19 future is one that is driven by research, inclusive of women in decision-making processes, and compensates women for the work they do. Thank you.
Thank you very much, Zamanzima. I would like to just remind us who was speaking. Zamanzima Mazibuko is senior researcher in the Knowledge Economy and Scientific Advancement faculty at MISTRA. She obtained her Master of Science, Med, in Pharmaceutics cum laude, and has published on nano-enabled drug delivery technologies in amyotrophic lateral sclerosis, and has a pending patent filed with Wits Enterprise for nano-enabled drug delivery. I wanted to come back and make a point of indicating who was speaking, because we are all committed to an approach where no one is invisibilized, and it was correcting the fact that I didn't do an inappropriate introduction in the beginning. Welcome back to plenary session. Few minutes at this point to feedback from the breakaway sessions, and I'm sorry that we're really compressing things, but can I ask, and I'll start with Lebohang, if you in 4 minutes can capture quite an engaging session, both in terms of especially what came online. Can I give you 4 minutes, and then I'll go over to Nikki Gentle. Over to you, Lebohang. Lebohang, are you on? Nikki, can I go to you in the meanwhile? And we will share this beautiful poem for everyone to enjoy it. So Nikki, are you able to come in? Oh, there you are, Lebohang. Don't sigh out that. We'll get through this one too. So over to you, Lebohang, and then Nikki.
Thank you. If Nikki's okay, thank you. In brief, I'd like to say that it was, as you say, a very engaging session, and I think there are a few things that I'd like to just pre-see it as. The one is are we looking for a reform agenda, or are we looking for a revolutionary transformation agenda? And there seemed to be a binary that emerged in our conversation, and I think that the questions were asked around gender budgeting and how it can influence perhaps rural women. It can influence a far more reaching, inclusive social, and recreate and recontract the social compact, actually, because we often think about people who are marginalized as those who are very peripheralized, but there are different forms of being peripheral. We are often peripheral even in our own context, in our own homes. For example, the ways women and men experience poverty, even in one household, is not even the same. And poverty has many layers and many voices, right? So the poverty of time, the poverty of voice, the poverty of access, the poverty of power. So even there's a gendered, layered approach. The other thing that I think came out quite clearly was around value chains and the need to really rethink what value chains and rural chains look like, agricultural chains look like. And I think Jomo Kwame mentioned that at some depth as well, you know, the corporatization of food production and how in this moment it has actually become the thing other than healthcare that is very much a defining factor of how we are managing our health, our well-being. Unfortunately, we didn't get to emotional and psychosocial well-being, but that's extremely important. But I think that this is also a good moment to think about how the vaccine and its the oncoming vaccine deals with biopiracy, deals with bio-racism, biopolitics, and biogeography, and actually reinforces existing power relations, which are framed, I think, for about a year or so. Quite a few of us have been talking about, you know, the colonialism, farmer colonialism and farmer capitalism, and how this is again linked with, I think, what Professor Lenka-Bula said, the multifaceted pathways that are not only biological, that are not only medical interventions. And then also to mention the IMF, the role of the IMF and the World Bank, that also came up as well as a point. You know, what does it mean to actually have these are really the arbiters, right, of global finance. These are they hold the petty cash for the world. Do they really have the opportunity right now to engage with them? There's a credibility deficit that's of the last 40, 50 years. Many of us who grew up in the 1970s and 80s will remember what the IMF did to African states and hollowed them out and turned them into shallow places. So what does that mean in this time? There's also an interesting point that was made around quite a problematic term around the nanny state. And I think somebody responded to say that that's quite a misogynistic term. But what does social redistribution mean at a time like this? Are we able to shift our language appropriately to match and to encompass our circumstances? The definition of work has often been linked to the definition of the time. So if we remember that 150 years ago, it was perfectly acceptable for Black and brown bodies to be stripped out of the African continent, and this extractivism, which is really the buttress of our global economies even today. So the extractivism of black and brown bodies 150 years ago to other worlds, that was seen as acceptable, that was seen as work. Enslavement and capture was seen as work. And of course, social mores, political mores, medical mores, things must shift. And are we taking this opportunity now in the COVID and Corona moment to rethink our vocabulary and to rethink our lexicon? How are we framing work? So in a time when, of course, the dichotomy between work and home is actually not there, right? And our workspaces are often our home spaces. I literally spend 24 hours more or less in this little round room. What does that mean again for our definitions of work and how it is being recognized? And I think somebody asked the point around how are we going to recognize work in this time? How is our language going to catch up with that? There's also an interesting point and an important point made about how are we recognizing the rights of domestic workers when the workload has been increased. I also as well as sex workers, right? Because contrary to popular belief, people have not stopped doing work in the house, and clearly people have not stopped contracting for sex outside their own conjugal relationships, particularly men. It's that is what it is. So what are we doing in this time of Corona when we're talking about social distancing to rethink this? And if I can add on a very final note that, of course, even as we're thinking about the multiple ways of the multiple pathways out of this, what a feminist bailout could potentially look like, the rethinking of the ecological, economic, political, biological balance, the planetary balance with the earth. How then do we also rethink how, what work actually means, the precariousness of it, because we are all now very precarious. What does that look like? But we also have to be careful not to fall into the dogma of build back better, because building back better potentially means building back more of the same. And I would suggest building forward radically. Thank you so much.
Over to you, Nikki.
Thank you. So I think in the other session we had a very different kind of discussion. Maybe not as animated as the other session, but I think we touched on a lot of similar themes. And certainly one of them was, how can we build from this going forward? So our discussion was around how have we learned, what have we learned based on our previous experience to now make the room more inclusive for women to be included in policy decisions. We talk particularly about when it comes to reproductive, access to reproductive health and access to maternal care. We talked about how policy decisions in terms of transport and infrastructure actually had a knock-on effect in this area and resulted in higher maternal deaths during the lockdown period and reduced access to reproductive health, which has now resulted in higher birth rates in almost all provinces across the country over the last year. So these are unintended consequences of policies that were made without including women in the discussion. I think another area where the two sessions kind of overlap is when it came to the importance of food, and we got the comment that there's not enough emphasis being placed on the importance of good nutrition in helping to keep an immune system strong, because when we are dealing with a situation where we have malnutrition, and particularly in children and women, you were setting yourself at a disadvantage when it comes to disease course in terms of COVID. You're more susceptible to infection, and you're more likely to end up with severe COVID or end up in hospital when you are malnourished. So there needs to be more emphasis on the importance of good nutrition and better access to good food. We also talked a little bit about the gender pay gap and the issue, particularly in the healthcare sector. Is there actually anything being done to address this? I'm not sure that there is, particularly when we know that the vast majority of healthcare workers and frontline workers are women. We were asked about danger pay. I mean, I don't think anybody's even thought about the idea of danger pay for frontline workers. But I mean, this is the kind of mentality people have, is that these people have worked hard, these people have given over and above of themselves, and they should be rewarded for their efforts. And in terms of their giving, and in terms of what they've given, we also expressed a lot of concern about the mental health of healthcare workers. So while there's a lot being done now to ensure that they have access to PPE and that our healthcare workers are now being vaccinated against COVID, we are not sure that enough is being done to address the mental health issues that have stemmed from the mass deaths associated with peak COVID infection and what's gone on in hospitals during our peaks of the first and second wave. So I think those were the main points we touched on in our session. Yep.
Thank you. Thank you very much for really accommodating us by compressing very rich inputs, even though it may not have been the way we wanted it or the way we did it last year at Terfontein just before the lockdown. We were all in a common space, but now our common spaces look a bit different. So I'd like to give a vote of thanks at this point, and it goes to the speakers of the day, our panelists, our facilitators. You know, I'd also like to give a special thanks to the Thabo Mbeki Foundation under the leadership of Dr. Baum, and just the direction she's always giving and being there as a pillar. I'd like to acknowledge Mrs. Mbeki, the one who ensured that feminism is a F word that's acceptable to everyone. We'd like to thank you for being the champion of this International Women's Day event, and a leader on women and global issues, being ready to be there in the trenches and not shying away from pushing women in leadership and men for that matter. And then I'd like to thank the women and men who have joined us today across this platform and across our continent and well beyond. We've had 688 people, even at the moments when some may have dropped off. And I think that shows an interest and a commitment to the issues of the day. Finally, I'd like to thank the organizers of this event at the foundation and at UNISA. Professor Lenka-Bula, I want to keep for last your keynote address, that you've really triggered quite a lot of thinking and really provoked us all on dealing with, one, the pre-existing inequalities that were highlighted through COVID, and the fact that you're clearly saying we should not reverse the limited progress that was there, and challenging that we should even take it to a next level. I'm not going to attempt to summarize the issues that you have raised, because I think it has come through both Lebohang as well as Nikki when they spoke. But I think the one issue that must not be forgotten is that there cannot be a retracking women to cycles of poverty, and not so for girls and non-conforming queer individuals. We need to make a difference, and the debate has come up and was expressed as the binary between reform and revolution. I think Professor Sundaram says this is really more about reform that we're seeing right now. How do we ensure that we push and make a difference? How do we make change happen? What do we do? And I think we should live the hashtag choose to challenge the status quo. That's what it is about at this moment in time. Because at the end of the day, as UN Women says, and I quote, "A challenged world is an alert world, and from challenge comes change," close quotes. And I think all of us who are here today must ensure that we hashtag choose to challenge, that we will make a difference. And I think just looking at the various panelists that we've had here today, and I call the facilitators panelists as well, it's all people who choose to challenge. So to the media, the SABC in particular, and other agencies that has covered this eve of International Women's Day 2021, a thank you to you, with the understanding that it's your responsibility to bring these messages out there, the messages that talk about change necessitated by COVID-19, that's whole of government and whole of society. Thank you very much, everyone. And let's see you walking the choice to challenge. Thank you.